Hello, I'm here to give you a COVID update for our region, for our community, and our hospital. For our region, the trauma service area, we have experienced 7 consecutive days of our total capacity being greater than 15% for our COVID patients. That means that more than 15% of our patients in our hospital have COVID. In addition, 14 of 16 of our counties have been labeled high risk for rates of transmission. Because of this is moving us to level 6 on our COVID dial. What this means for our community is it means that we need a call to action. We are going to be reaching out to retired nurses, to physician extenders, anybody within our community who can help with our capacity. Because we are at such a high level of percent capacity of COVID patients in our community, we do not have the capacity for transferring patients into us or transferring patients out. In our community, over the weekend, we had 189 positive COVID tests. 48 of those were within the pediatric population. Since July 30th, we have had approximately 363 pediatric cases. We are seeing COVID increase within the younger populations and particularly within our pediatric population. In our hospital, we presently have 130 positive cases of COVID. We have 4 COVID floors that are at capacity. Our ICU is at capacity. We're presently more than half of our ICU is occupied by COVID patients who are not vaccinated. What does this mean? What is our ask to our community? Our ask has not changed. We are still asking you to mask responsibly. That means in large gatherings, indoor activities, and in our school settings. We are still asking you to social distance and wash your hands, both of which have been shown to be very effective in preventing the spread of COVID. Vaccinations continue to be a very important part. It is the most effective way of preventing COVID. Our Moderna vaccine and the Pfizer vaccines are still effective against the Delta variant in protecting against severe disease and hospitalizations. In addition, one of the best things that have happened, one of the most effective treatments for COVID includes our monoclonal antibody infusion, which is Regeneron. Regeneron is very effective in decreasing hospitalizations, ER visits, and deaths. Who qualifies? Well, there are 3 groups. The first group is anybody who's 65 and older, who are symptomatic for less than 10 days and who have a positive COVID test. The second group is the age group 12 to 64 who have any comorbidities. That would include pregnancy, obesity, any cardiac disease, lung disease, immune suppression. The third group is a relatively new group, which is in our OB population. Young mothers or young mothers-to-be who are pregnant, who have a strong exposure to COVID, are eligible for the infusion of the monoclonal antibody. And I would encourage those mothers-to-be to reach out to their physician to discuss that. Hendrick Health continues to have concerns with our capacity. At this time, we are unable to accept transfers into our facility. That means we are diverting those patients away from our hospital. That means the small hospitals in our region are unable to send patients to our hospital. It also makes it very hard for us to transfer patients to higher level care because those hospitals are also at capacity. Our emergency rooms throughout the Hendrick Health continue to function at a very high level of capacity. We have patients who are waiting to be seen. We have patients waiting to be admitted to our hospital that are being held in our emergency room for care. We do not want anybody not to be seen. I would encourage you that if you need any health care, that you always contact your physician or reach out to one of the walk-in clinics. In addition, if those are not available, our emergency room is always available. Our goal, as always, is to protect our community. It's not about individual liberty. It's about that person who is sitting beside you. Your spouse, your parent, your grandparent, your children. Our goal is to protect life and prevent death. Thank you.